Yes, we can go ahead and start.
Okay, thank you so much. Welcome, everyone, to our Implementation Science Beachside Chat. I am Alison Hamilton, your host for today's session. I lead the UCLA Rapid, Rigorous, Relevant Implementation Science Hub, funded by NIMH, part of a network of hubs that support ending the HIV epidemic. We're so excited for today's chat. I am beyond excited. I have been really looking forward to this for several months. For anyone who hasn't attended a beachside chat in the past, these are really meant to be as they sound. They're meant to be informal. They're meant to be opportunities to learn and engage and dialogue with experts in the field. The two I have with us today are so stellar. Just absolutely thrilled that they agreed to do this. Um, and I'll introduce them in just a moment. So, what we're going to do, just so that you're familiar with the format, we're going to go through a few slides just to orient everyone in the audience. Then we'll come out of slides and have a discussion that will be supported by all of you in the audience, putting your questions and comments and thoughts in the chat. And we'll be going back and forth and dialoguing about our topic for today. And then toward the end, we'll wrap up by coming back into the slides and just covering a few resources that might be of interest to you pertaining to our topic for the day. And then we will ask you to complete a brief evaluation, which is very helpful for us for the sustainability of these activities. So that being said, I'm going to get us started. Our topic for today is engaging community in implementation, state of the science and practice. We have two amazing implementation scientists with us, Eva Woodward and Sonia Singh. They are both clinical psychologists. They are both investigators with the VA in Little Rock, Arkansas, and also professors in psychiatry at the University of Arkansas. And to me, really doing some of the most exciting cutting edge work in implementation science today. I follow their work very closely, probably more closely than they even know. Um, and so I'm just absolutely thrilled that we get to talk about this topic today with such wonderful scientists and just have a great exchange with all of you. So thanks again for being here. And I'm going to turn it over to them to just do a little bit of level setting, and then we'll get into our chat. So with that, I think we can go ahead with your disclosures, and then you can let me know when to advance the slides.
Thank you. I am not seeing any slides right now.
Interesting.
First point, are there slides?
Okay, hold on.
Okay. Hey, everybody.
What time I thought you were seeing them.
I know. It's nice to meet everybody there. Some of our disclosures before we get started are that I'm a consultant for ViiV Healthcare, who is one of the pharmaceutical companies producing some of the innovations to be implemented to end the HIV epidemic. And I'm not here on behalf of them, and they don't stand to benefit, nor do I, from this presentation. And Sonia and I also want to share just a little bit about how our presentations or our views don't reflect the institutions we work for, such as the US government or the University of Arkansas for Medical Sciences.
And that we are also here as individuals, not on time of any of these institutions.
Yes.
Thank you. And can you see the slides now?
Yes, please.
Okay.
Do you want to start us off?
Sure. So engaging end users affected by health problems is the gold standard in health disparities research and probably should be an implementation too. Eva and I both historically came from more of a health disparities background, and I think very similarly found ourselves in the implementation space from what we learned from the health disparities background. We're both clinical psychologists by training, and I found my way to implementation science by wanting to learn more about how we make evidence-based practices, best practices, and then especially how we do that for marginalized populations.
Mm.
And do you want to say more about that?
You said it perfectly. And I guess one of those ways that we both started theorizing back when we first met 7 or 8 years ago in Little Rock was around how to help implementation science ground itself more in traditions that are helpful to reduce health disparities. So such as community engagement and community engaged research. Okay, next slide. So we're just going to orient to just some of the 4 slides on the state of the science on this. Will you click? Thank you. So one thing to know is where is the evidence on this right now? So preliminary studies suggest that engaging the end user in implementation can retain people experiencing health disparities or marginalization in research studies, and that it can also improve provider fidelity when they're delivering clinical interventions, and it can improve patient health behaviors and ultimately their outcomes. And including end users in implementation results in better systems design that's more patient-centered than without. And it also can result in the greater use or uptake of effective healthcare interventions in community settings. And you can see all those citations there, and it's quite sparse, the existing studies on the impact of engaging end users in implementation. So this is really a cutting edge, a burgeoning area, and one perfect reason why your amazing hub here had the foresight to invite us to all talk about this today and what we're all doing. And we also should say what we mean by end users. We're approaching this thinking about the ultimate recipients of services. So examples.
And oftentimes we think of that as the patients who are receiving services, community members, but I'm really interested in implementation policy work. So the end user can be the recipient, like the patient who is affected by a policy, but it could also be the policy actor, like the provider or the leader. So really that overarching definition of who is receiving the thing is what we mean when we say end user.
Mm-hmm. Yes. Now, what you're seeing on the slide here are end users as in a patient or client. It could be students in an educational setting. It could be people who are incarcerated in a criminal justice setting. And if you're in healthcare or CBO or something, it could be a client or patient. That's what's reflected on the screen. But we'll try to distinguish, and maybe in your questions and thoughts, distinguish between who the end user is. Okay, next slide. This is a favorite of ours. Sonia found this.
Yes. So browsing a website back probably 5 years ago, I came across this and I sent it to Eva and I said, we have to include this as to why user engaged work is so important.
You've got these parents on the left side. They're the implementers. That's all us in our systems, and we're out here designing strategies to get these great HIV prevention or treatment programs going on. And they're these mobiles, for a baby's crib. And we're like, oh yeah, at the end of multiple years of hard work and so much thought and millions of dollars, we're like, I love this. This is awesome. And to the baby, it's just butts. Just butts. And how often has that happened to you? We have all been students somewhere. We've all been, I hope you've been a patient somewhere. Hope you're getting your checkups and your screenings. And how many times have you had the experience when you go through some process in healthcare to get healthcare or to investigate something, and you find yourself running into really obvious issues, whether it's something simple like the way the waiting room is set up, or something more complicated like the entire flow or the complete lack of inclusion of certain disciplines or providers in care for a certain issue. And you thought, this is really terrible. Did anybody think this through? And the answer is, of course, a lot of people thought it through. all those implementation people, they thought it through, but they didn't think it through from the user perspective.
Mhm. Or include the user perspective. And so in our lab, in our work group, we often have a saying that's like, all right, let's make sure it's not just butts. So as a way to make sure that we are including the user perspective in what it is that we do.
Yeah.
So hope if folks take away one thing from this talk, I hope it's this image.
Next slide.
You know, you are known for papers with really good titles, so you could have a paper that's not just butts. I think it would be really successful.
Okay, new career goal right
Yep.
there. So if wherever you are in implementation science, I just want to orient and level set that at this moment in time, there's like so many implementation strategies, and they've generally been clustered into 9 clusters. I think there's an additional cluster out there right now that I failed to include here. But most of them fit into these 9 categories. And, you know, how do we get interventions actually used? How do we make, as Sonia said, evidence-based practice is the best practice? And obviously there's stuff on the right, you know, we want to be able to fund it. We want to develop relationships between all the people implementing, the knowledge experts. We want to support the clinicians providing it, et cetera. But the top left, there's an engaged consumers cluster, and that involves 5 things as stated in the ERIC project. Using mass media, involving patients in uptake or adherence, let's say of HIV testing or of PrEP, for example, involving patients or consumers and families. In what or how, I don't know, but that's what it's listed as. Prepare patients or consumers to be active participants in their own healthcare and increase the demand. So increase the pull for an innovation as a strategy. So that engaging consumers cluster, as you can see, the strategies don't have enough specificity yet to really be actionable. When I really sat down multiple years ago to start studying this, I started reading more and I thought, but what exactly do they mean? Or one of Sonia and I's favorite questions.
How do you actually do that?
How?
That is always my question.
So we did not know. One interesting thing is that number 4 there, preparing consumers or patients to be active participants, actually in a very recent robust systematic review of strategies has some of the strongest evidence of being an effective strategy for uptake and reach compared to others. So it's clearly really important that we engaged this important group of people, the people who receive the service. Okay, Alison, we're ready for the next one. So here's to put some specific examples. Sonia, I'll let you read this.
Sure. So thinking about those consumers as members of your QI teams to improve the flow of patients through various mental health services. So again, consulting the folks that the mobile is being designed for. Consumers consulting on intervention marketing materials for new HIV prevention program. Oftentimes marketing materials are created and we might pass them through our own channels, but actually doing some user testing and getting input from them to make sure that these are materials that are accessible to folks who are being seen in these prevention programs, making sure that we see folks who are being represented with these prevention programs. So I know oftentimes we might create marketing materials and put pictures of folks on them and recognize after the fact that they are not really representing the folks who we are trying to reach. And then consumers participating in dry run practice walkthroughs of a telehealth intervention for people with spinal cord injury and helping implementers refine the process. So actually getting feedback on interventions, what's working well for folks, what's not working well for folks, and then using that as an iterative process of improvement. So making sure, again, that the folks who are going to be the most affected are actively engaged in the process from the beginning and throughout the design process.
Yes. And so these are just sample ways.
Mm-hmm.
Okay, so the final slide to just finish our level setting. Oh, good. I'm glad. Oh, thank you. I'm glad. There's a reason we had that animated there. This is not consumer engagement or end user engagement and implementation practice or science is not patient activation, like from public health fields, for example, or communication science. And it's not engaging patients to be more active in their own healthcare. It's about engaging them in the process of designing services or even quality improvement of services that they will use. Okay, really ready for the next one. So, one of the first questions is like, what are people doing currently to engage patients in let's say, in healthcare implementation? And so some of my colleagues and I did this environmental scan of 3 data sources in US healthcare implementation. So we interviewed implementers that through just like a wide call for people who said that they were engaging patients in some quality improvement or implementation design initiative. We also did a systematic review of the literature on this topic, and we also did a systematic review of existing webinars that belong to different like implementation repositories, and ultimately found, several examples of what people are doing already, because people are doing that and doing this work, and it might be you. Thank you. And also documenting the common challenges people ran into and documenting some of their solutions that they had. So this is a good paper to kind of see what's going on currently in implementation practice itself. Some of it was in the context of an implementation research study and some of it wasn't. So that's just a good starting place. Though that I just wanted us to kind of have that language of the engaged consumers cluster of implementation strategies to give some examples of what that might look like. And, each of the end users or community members might be different based on your initiative. So let's just all be careful to reference who we mean when we're talking about that. Okay, that was all of our level setting.
Mm-hmm.
Great. All right, so we'll come back to resources toward the end. I'll stop sharing. Let me just get out of here so I don't get confused. Okay, wonderful. Thank you so much. That was in and of itself thought-provoking and important. So I'm hoping that we can actually hear more about your efforts in this area. And if you could talk about consumer voice and, the how part that I think you're both very, very actively doing right now, just to orient the audience toward how you're taking steps in this direction and the innovations that you've been developing. And then, we can move on from there.
Absolutely. We were both part of a design team in an intensive user-centered design process to develop tools to answer how do. And because some of the best ideas come out of need. And that was a need that both of us felt. Do you want me to talk about that, or do you want me to?
Yeah, you talk about that, and then I
Okay.
was going to talk about my policy progress
Got
report.
it. Okay.
Yeah.
So some tools that exist now, they're right now called Consumer Voice, and they became publicly available in July 2023, and it's in your resources slide, so don't panic. And they're free, and they are tools that are meant to guide an implementation practitioner or an implementation researcher in the who, what, how, when, why of engaging community members, end users, service recipients in the process of designing, implementing, and sustaining any initiative. So it can be used by, people who are in quality improvement personnel jobs, middle managers, or those of us who are in research jobs and we're doing implementing and working on implementation practice. So Consumer Voice is free. It's generalizable to any setting. our development process was very intense, and it was a whole user-centered design experience over 2 years, and it had a lot of repeated iterations of development from multiple groups of people in the community who represented different factions, if you will. And then also a lot of different experts, like community organizers who don't even work in healthcare, who really know how to do this in other ways.
Mhm.
And then implementation experts, and community engaged researchers, and people who study or work in very different settings. We had education people, we had people who work in carceral settings, we had people in mental health care, physical health care, and then we had a design team that I led and that Sonia was on, with also patient representatives who made decisions about what are the core principles of these tools, what will the tools look like, and we did a lot of prototyping. So those are available. They operate on core principles, that align completely with community-based participatory research. And that actually was not intentional, but that's what happened. And so it's really, if you are coming more from an implementation science lens, it's really about how do you then go learn from this other paradigm, this other approach, CBPR, community engagement, but bring it into implementation practice. And it's modular, so it's different modules. It's meant to be like pick your own adventure. And one of the important pieces of feedback we got in our user testing was that there's something for everyone there.
Mm-hmm.
So there's things that, like, a person brand new, they might need to work through the first 5 modules, and that's what they're doing. But someone already pretty experienced with community engagement, those folks still said there are things here for me, like modules on normalizing mistakes and course correcting when things go awry. Things like how do I co-lead an implementation effort with community members, things that are pretty advanced. And they're also meant to be highly digestible. So they're really bite-sized slides, there's written documents, there's audio voiceovers, and all of the materials are 508 compliant, meaning they can be read on a screen reader, by someone who has any reason they would need to use that. So that's been, and I am pilot testing them formally right now. So that's the state of those things. I hope that it gets used more. One update is that as soon as we released it, then I gave birth. It's amazing how that happened. It was metaphorical.
Gave
Like my
birth and
work
then you
was,
gave birth.
yes, my work was going out there, but then I gave birth to my second child. And so then I was, not at work for 4 months. And I came back and there were a lot of complaints about the use of the word consumer,
Hmm.
which is interesting because in all the 50 people that weighed in from all these different aspects, it was never brought up. So actually we are doing a small study right now to rename it. Because there's no need to have a name be a gate. There's no need for that. Taking suggestions.
I was going to say, what are some alternatives that do people say it's not good and here's what you should use instead, or just say it's not good?
They say it's not good.
Okay.
And the complaint behind that is that some people with lived experience would and do adamantly oppose that term consumer because it implies that there is like a choice of services when sometimes there really isn't,
Hmm.
which of course I both relate to and believe. And so we are halfway through our study to generate new possible names. And the actual end user term still is highly, highly contested. Some people say, oh, consumer is actually, like, I really align myself with that. And some people have adamantly said, there's no way, like, please don't ever call me that,
Hmm.
So we still have half of the study left to finish. So we'll have to make sense of that to ultimately come up with some nomenclature that could probably be adaptable depending on your setting. And for the name of the tools, one of the most clear suggestions, I don't know if I've gotten to tell you this yet,
Mm-mm.
is actually just changing it to be a verb
Hmm.
instead of the noun. Someone was like, what if you just talk about like including voices? I'm like, okay, hadn't even thought of that.
Interesting.
That's where it's going.
Hmm.
We shall see.
Okay.
Open to any other thoughts on that, but
That
Yeah,
is
we might
interesting.
get some there's some chat happening around that as well. Users, clients, when said they've gotten similar feedback about the use of consumer. So
right.
language is it's very important in this engagement space.
Mhm.
It's tricky
Mhm.
because some what works for some doesn't work for all.
Absolutely. Absolutely. And things need to be tailored.
Mhm.
In fact, in implementation, we're having more and more science showing that tailoring our implementation process, tailoring strategies is an incredible key for success.
Yep, absolutely. We are getting some great stuff in the chat, but I think that Sonia was going to also share a bit about some efforts, and then we'll keep everything coming in. We're gonna try to get to everything, but I just want to hear maybe a little bit more of another example from your work, Sonia, and then we can check in on what people are thinking about.
Of course, and I can give the Reader's Digest version. But one of the projects I'm currently working on is an LGBTQ plus progress report to measure alignment with LGBTQ plus affirming care policies. And these policies happen at a medical facility level. And so the folks who are yes, the end recipient of the policy are patients who are LGBTQ plus, and there's certain directives for medical center leadership and for providers as well. And so the folks who are actually completing this progress report and then using it to make changes are leaders often. And so in this project, before we even launched the progress report, we got a lot of feedback about the wording of the progress report, about how the progress report should be sent out to folks, and ways to really refine this process before we did it. And I remember hearing from a lot of the leaders, we have never been asked about a tasker before we received one. And so I think, in policy, there are a lot of different end users. And so I think at a basic level, the folks who are going to be using whatever it is that you're designing and that you're implementing, really making sure that we are asking them for feedback in the process. And so that's just a small example of a way that I've applied some of these principles to policy implementation efforts.
Mm-hmm. And that user-centered design has been
Yes.
important for both of us.
Yes, yeah, definitely doing
Mm-hmm.
a lot of user-centered design around creating tools, around developing streamlined processes, actually sharing in real time, getting feedback
Mm-hmm.
on whatever it is that we're planning to implement. I think a lot of times we might get feedback through things like interviews about an idea, but it's different when you're actually showing them the thing that you're implementing and making changes in real time based on that
Yeah.
feedback.
Yeah.
Well, and I think one of the challenges that I've encountered is, there's the desire to have those feedback loops, but they really have to, in my experience, you have to be really intentional about the timeline, because it's not like you can say, hey, we worked on this thing and can you give us feedback by tomorrow? That doesn't foster any goodwill. So even for us wanting to do this and thinking, okay, what would be a reasonable approach to giving people enough time and bandwidth to provide the input is it's a shift, I think.
Yes.
Right. And I think that leads to one of the other things. A lot of times this work starts way earlier than we maybe want to engage in an implementation effort. And I think that's one of the things that can be so tough about it, but often so important, because if we can really get a lot of feedback and input on the front end, it might potentially offset some of those implementation challenges down the line. But I know that's often a challenge that comes up. That's, this is a lot of times not in line with how grant timelines work, or how publications work. So I think that is a challenge.
Absolutely. We have a lot happening in the chat. I have several questions I would ask, but I'm going to make sure that we check in on the dialogue that's happening there. So thank you so much, everyone. Clearly, we are talking about something that I think folks are really, really interested in. So there's a question about providing compensation for community members and users as a way to acknowledge their expertise and time. Anything you want to share on the compensation issue?
I mean, in consumer voice, that's a core principle. So yes. What would you say?
I will also add compensation the way folks want to be compensated.
Yeah.
Because I'm often surprised. There are some folks who are like, oh no, like, I don't need money, or like, whatever you give me, I'm going to donate. But like, could you put me on a publication? Which, absolutely. Or like, can you show me how you do this work so I can then take it to or like, would you be willing to come give a talk to our organization? So I know there can oftentimes be barriers to compensation, and we absolutely should look into ways to compensate folks within our own systems financially. And I think one of the things that I've been personally surprised by, and I think have adjusted to, is compensation the way people want to be compensated.
I know. I've had the same experience. And I think some of it has been, I've done different community engagement with different groups, but one of the major groups working in the VA is our veterans. And actually, a lot of veterans will say, I don't, like, this is very much in service of like my fellow service members, and I don't want to be paid, which has been a surprise. So we found other ways. And then importantly, finding a way to actually translate that, like, because what you're saying, people might not know the possibilities. And one thing that I've started drafting on some of my work that I hope to use going forward, we've had just like these conversations, what Sonia's talking about, like the people who haven't wanted to be paid, I've ended up like editing their resume for them, and then
helping them get jobs.
Yes, that has happened. Right. Right. And lots of different stuff. And then also just paying people financially. That's also a thing. And the one tool that I've started drafting, I intend to use the next time, is kind of like a menu of choices. I don't actually prepare any materials to go talk with community members about a specific ask until I know what the choices are for compensation. And that's just a personal, I'm not going to somebody asking them for work without offering what's what they're gonna.
Sometimes that can be very much shaped by institutional parameters as well. And even require some education about, here's why we want to compensate people in the way that we do. That might be different than paying subjects for participating in research.
Yeah. And I think sometimes that's us providing that education to our institutions, and using the power that we have within our institution to potentially take the burden off the folks who are working with us.
Right. Yeah. Definitely. Okay, I'm going to move on in our chat. Considering your experience, our current climate, how do you engage consumers that are part of a vulnerable subpopulation and may not feel it's appropriate to share their feedback, or feel mistrust. I'm paraphrasing a little bit just in the interest of time, hopefully still respecting the point. But feeling fear or mistrust related to involvement or engagement. Uh, Definitely a timely and challenging question. Appreciate it.
Mhm. Yeah, I mean, I think part of this is I feel like I don't have a perfect answer to this right now, especially because I think we don't know a lot of what's going to happen right now.
Mhm. Mhm.
And I can say, in the past, some things that I've done is really try to approach with uh, honesty and vulnerability on my end. I do a lot of LGBTQ plus work in general, but especially thinking about the transgender and gender diverse folks I've worked with. I'm a cis person. And so in a lot of those initial meetings, just kind of laying groundwork and understanding. And I know, like I've used the phrase before, um, I just want to make sure that I'm not being like a cis a-hole. And in a lot of ways, like, I remember having that conversation with someone and they said, like, the fact that you are even thinking about that, like, really helps me understand where your head's at and that you're really trying to come here to do right by our community. Um, and so I oftentimes think that leading with that vulnerability, and not just like, I'm here to use you for science, which I think all of us who are in this room are not trying to do. Um, and I think can inadvertently sometimes do with what our institutions value.
Yeah.
So keeping that in mind. I also think making sure that there are a lot of folks with different lived experiences that you are reaching out to. So not just, one person who is speaking for an entire community.
Mhm.
That is a way to make sure that multiple voices are being included and we're not just saying like, oh, you're our person on this study who's representing all of the voices of this community, because there's a lot of intra-community differences.
Mhm.
And one thing that you were speaking about, when you said like kind of showing up and talking about your identities and how they may or may not be shared with others, is an element, is a best practice for doing all kinds of work with different people, which by the way is all of our work. Heads up, everybody. And so surprise. And so to put words on that from another field to like just translate for a moment, known as like reflective practice or identifying our positionality. So our positions from how we see the world are shaped by, all kinds of life experiences we all have. And so there are ways to address, I believe, Aliria, your question, if I'm pronouncing your name right, with in the chat, that kind of that differential in power imbalances between the implementers and the people who will receive services. There are good best practices from all kinds of fields on how to, one, recognize that those exist, and two, minimize them. It's very unlikely they would ever be eliminated. And I think that's important to recognize. And those best practices, we actually have a module on that in Consumer Voice. I feel like I'm selling like I'm on an infomercial. I'm like, oh, well, Consumer Voice has, but it does. It has.
It's great. It's worth selling.
Thank you. It's worth selling. Consumer Voice has a whole module,
But it's free.
But it's free. Yes. Consumer Voice has a whole module. Yes. No. How to make people feel included. And it's actually all about it has very clear techniques drawn from many areas of work outside of science on how do we both recognize and address or minimize power differentials. So I'd encourage you to actually go look at that, because there's quite a bit there. And, some are more actionable than others depending on your setting.
We'll have QR codes coming up
That's
for
right.
anyone who's like, where is it? It's getting very exciting to see it. So there'll be QR codes on the slides toward the end. Thank you for those comments. Wonderful. There is a question about, Kenda said, love the verb idea and using people's voices. And Katie just asked if you'd be able to summarize some of the main challenges or solutions from that review. I think maybe the environmental scan.
Yes, yes. So in the environmental scan of what are people doing in US healthcare implementation to engage patients, there were 9 common challenges, and I can't name them all off the top of my head, but I remember the top ones. And the top ones were difficulty recruiting people who actually represent the population of end users. Sonia alluded to that earlier. So, gosh, and even in places where I know people are making real efforts to do community engagement, they might have a community advisory board set up for their implementation effort or whatever. And, I'll talk with them and they're like, yeah, like the only people we can get are like masters and PhD people here, and that's not like the majority experience of the people that we're trying to serve in this health system, for example. So actually finding demographics and people who represent the actual end users is one of the biggest challenges. And then the second biggest challenge was retaining them. So once you recruited them, keeping them engaged, and then dealing with turnover. And so a lot of there were lots of different solutions. One thing to remember about that environmental scan is like none of these solutions had been tested. So who knows how well they worked, but people had a lot of the same solutions, and you would probably have a sense of how feasible or effective it might be in your context. So a lot of the solutions for those challenges were to work with proxies in the community, trusted liaisons in the community, like maybe people that, lead organizations or lead nonprofits, even if they're not like in the area you need to be in, they can be, what's the word I'm looking for? Like, liaisons, like kind of people to then say, you know what, they can get to know you, see if they value your initiative, trust you and your team. They get to weigh in on some of how this process might run. You can change some things, and then they can say, you know what, let me go get some people, basically. So that's one way. And then also another solution was then making sure that the ways of working were accessible to people who do not work in your environment. Like to set up this call, it was like, okay, hey, send in a Zoom link, got your Outlook, know it's going to be on the calendar, and we're all tracking and we all somehow show up here. Right. How many times have I done community stuff where I use those methods and nobody shows up because they're like, I don't work, or I'm retired, or
I don't have a computer.
I don't have a computer, or I live in such a rural area. I have a computer, but like I don't have Wi-Fi. It like never works here. So, and that takes so much effort to figure that out, but you can also figure it out sooner by asking.
Yeah. How would you like me to communicate with you? What works best for you? And so we'll end up like texting.
WhatsApp.
Yeah.
We do GroupMe. We or we meet in person at like, okay, we're going to have, the meetings will alternate between being here and being there. And so things of that nature were some of the solutions that they came up with to actually reduce the recruitment issue, the representative populations, retaining them. And then a big one, actually, a big solution that we identified in that scan was recruiting, as Sonia said, a number of people rather than relying on a few, because life happens. Things happen, people get sick, jobs change, people move, they have to leave. And so making sure you have more. And the third main solution, and I'll just stop here and you can read the rest. We have good tables of them, was about taking care of a lot of the admin burden for people. So really making sure that you and your team or someone else are the ones like sending out the minutes, taking the minutes, keeping the schedule.
I feel like you also did this on your safety, like helping folks fill out forms that might be required for compensation.
Oh, that's right.
Any of that bureaucratic stuff.
That's right. That's right. Thank you for reminding me of that.
Yeah.
Yes, like, then eventually training an RA on my team, like, okay, so you're going to be assigned to like the compensation piece because it's so freaking convoluted and we don't need any more people going through it alone. And so, yeah, things like that. And those are what we found in the scan overall, but you can look there.
Thank you so much. And Benjamin asked about differences between engaging recipients in low and middle income countries versus in high income countries.
Great question.
Any thoughts on that?
Well, right. One thing, actually, that environmental scan, Benjamin, was we then tried to contextualize the results from U.S. healthcare to other countries that have actually stronger infrastructures to do patient engagement. But all of those are pretty like wealthy countries. Canada, the United Kingdom, and Australia. Like, for example, they all have like part of their government is what they call patient and public involvement. And it's a requirement of every research grant, but certainly also of just like how they deliver systems and how they design things. One interesting thing was we noted that things in the US actually, with totally different, political atmospheres, economic ways that healthcare is received, the challenges faced in those places that have more infrastructure than the US for patient and public involvement were not that different than the US. So that was interesting. They're still facing a lot of the same challenges. So a lot, and almost none of the literature we reviewed to contextualize how the US relates to other countries was from lower middle income countries. The stuff that we did find was that the low and middle income countries this is Eva's take, okay? This is not anywhere published. My hot take is that they were doing some of the most like innovative, really like so much more pure, like bi-directional, mutually beneficial, trust building community engagement. Like, for example, in Vietnam, like building the capacity of lay people to work as implementation facilitators. And that's an example. I remember that for implementing basically like a prenatal care, like a whole prenatal care package. And that was very powerful and, by the way, effective in the research that they did. So I think that's one major difference is like the use of task shifting or community health workers, or even this is like not a concept that really is a thing in the US at this point, but I think could be, which isn't community health workers like delivering the intervention or connecting them, but like community health implementers. Helping to deliver strategies. So I think that's what I know of that. I also have implemented for a year and a half in a low and middle income country in the Caribbean. And it was really different. And it required me to practice a lot more reflection with me and the team that I was working with, and have some of the conversations Sonia brought up about positionality, about how it can help me understand this. And I also did a lot of homework that they didn't need to teach me, like Google's out there. Like, I read up on, and that was actually for an HIV intervention. And thank goodness I was like reading up on the laws and the regulatory stuff about it. And like same-sex behavior is criminalized in this country, which is a major way that HIV is spread. In that country specifically, they didn't have a lot of spread through injection drug use. And so it's a whole thing. It's a whole different element. And there are people who are doing a lot of implementation and engagement of communities in low and middle income countries. And I think going to learn from them is really, really important. Is there anything else that you wanted to say from your knowledge on that?
No, I feel like I learned from hearing you talk as well. I think I was just thinking about the thought of oftentimes certain communities will have this phrase of like, we know how to heal us. And as you were speaking, it made me think about that. And often, so I'm a Punjabi American, a South Asian American, and I think about that there in my own community, there's a lot more like collectivism in that way. So I don't have any fully formed thoughts on that, but as you were speaking, it just
Reminded
me of that. Yeah. And made me wonder what that could look like. So yeah, nothing empirical to share, just personal.
That sounds like an important next step. And maybe Benjamin and others will be, paving the way on that, like community engagement and implementation in these different global contexts.
Yeah, and there's a comment from Leslie about being able to do innovative and meaningful engagement in Kenya with the Youth Advisory Board and youth peer mentors becoming researchers and RAs. And then they're very motivated and inspiring. So it's really exciting to hear examples from folks in the audience. Thank you so much. I know we're getting to the top of the hour. I had a feeling this would go very quickly. And sure enough, and Katie just brought up having a slightly different end user in terms of being staff who are using software that Katie's been developing and, kind of the challenge of helping management see the benefits of engaging users. And I think, if I may paraphrase, kind of making the case for engaging the end users and whatever other terminology we want to use. And so that's, really point well taken. Katie, I don't know if either of you have any thoughts on that, like sort of getting management to buy into the importance of this form of engagement.
Yeah, I think some of it sometimes is doing some wordsmithing to make the case. I know it's not, that's not always going to be able to get everybody's buy-in. But I know in my projects, I've used the phrases of like, please help us in developing this like new innovation or something along the lines that's highlighting that it's going to help them somewhere along the way if they put in the input now, to make sure this is as user friendly as possible. I don't have exact like the emails that I've sent before, but I've asked folks sometimes like, what made you want to participate? And they'll respond of like, I get to have input on something that we're going to eventually implement. Like, yeah, I want to make sure that I get to provide that input. So it can be making the case that way. If you are able to look at cost benefit, like if it's going to save employee time later, if it's going to save your time later, IT time, that can be a helpful way to make that case as well. And value can be not just monetary, but
opportunity cost.
Yes.
Spending more time now means less time messing with the whole thing later.
And satisfaction can be value as well.
And I think, you know what, Katie, I think there is some literature out there. I don't know what it is, specifically on like economic benefits of community engagement. If you need to make that business case. And you also might look at actually the first module in Consumer Voice, because it's like preparing to, it's why work with consumers. And there's also a lot of compelling stuff out there from really like community-led, we know how to take care of us, nothing about us without us, like from the disability rights activism, that just makes so much dadgum sense. It's hard to refute. It's, so you might go see if there's anything there that is compelling, you think, for your audience.
I like it. I'm going to bring back up the slides just in the interest of time, because I'm guessing folks would really like the resources that you've been touching on. So especially those QR codes. So let me just bring these up and, let me know if you want me to pause anywhere.
I did want to say how I organized it. How Sonia and I decided to organize it was there's some core things that on this topic that might be helpful wherever you are in an implementation effort, which you're looking at right now. And then there's consumer voice. And so we can be there for a moment.
Yep, I'm going to pause so people can get their cameras out.
But then we went on to, oh, yeah, I'm out, I'm in. We went on to list them by phase of implementation. So in the work you're doing, on the teams you're doing, there's some that you'll want to use throughout, including consumer voice, but then we put them later on. They're just there for reference for you for like pre-implementation, like planning to launch something, actively implementing, and then sustaining. There's a lot more to this phase.
I'll give everyone a minute, and we can send these out to folks who registered as well. So don't worry if you're not able to capture everything. But just so you can take a glance at pre-implementation and then some implementation phase resources. And as you note, there's a lot more that we can do in this area, a lot more development and science. I would like a whole other session on assessing outcomes related to engaged.
Ooh, me too.
Research. Can we do this, the whole thing on that?
I would love to be a part of that and learn, and that's what I'm writing and doing right now.
Yeah, let's think together about that. Everyone in the audience too. And then there's sustainment phase resources as well.
Yeah, and even these are good nodes, if you will, or good kind of preliminary work. And none of this that's actually on here, and please correct me if anyone else knows here, I would love to know, but I don't know of a lot of good like engaging communities and sustainment implementation stuff.
Yeah, please. I'll put up our emails in a minute. And if you have stuff or of stuff that is in this realm, I know we would all really appreciate learning about it, because there's just constantly new things that we get familiar with that are really exciting in this area. And then just want to make sure that you have a chance to acknowledge your support.
Thank you.
And these are our ways of contacting us. Thank you, Enrique, for putting the evaluation link in the chat. It really takes like maybe 2 minutes. So if you could give us your evaluation of today's session, we would really greatly appreciate it. It helps to support our efforts to continue to make these activities available. We're getting lots of claps and love, which has been so fun to see throughout the session. I think everyone's take home is not just butts, and that is a great take home. I love it. I think that's gonna really sustain, actually.
I think so. I think that's what Katie needs to take to this upper management.
Exactly.
I think Katie said that. The image will help. I saw them mention that.
Hilarious. So Eva, Sonia, I can't thank you enough. I think we could go on for hours, but this has been a wonderful way to at least get our feet wet with these issues and learn about the amazing work you're doing in this space. So appreciative of your efforts, your innovation, your commitment, and your time for being here today. It's always so enriching to be able to interact with you and learn from you. So thank you so much. From me and from the hub and from our audience, you're getting lots of love in the chat as well. So thank you so much, and thank you to our audience for a really lively and interesting session, and we hope to see you back for future Beachside Chats. Thank you so much, everyone. Have a good rest of your day. Take care. Thank you. Bye.